Mr. Williams believed that if we can open the space between the bones in our spine, if we could gap the zygapophyseal joints, which is a fancy word for those facets that lock in the back portion of each vertebra, which look like roof shingles, really. If we could open up the IVF or the foramen or hole that holds the spinal nerves, that covers the spinal nerves. If we can open that and relieve pressure on the nerves, if we can gap the zygapophyseal joints, if we can stretch the ligaments in the low back, then we can help to reduce pressure on the discs, the cushions that sit between the bones. And that's a good thing. We'll reduce pressure on the nerves and the discs. So what is the first step towards that, he thought? Well, laying on your back and pulling your knees into your chest. And so he founded a bunch of different exercises they call Williams exercises. Now, extension exercises are also good, most commonly known as McKenzie exercises when it comes to your low back, are also good for your back, right? But it depends on the course of treatment. It depends on your specific diagnosis, your symptoms, where you're at in the course of your treatment, to determine exactly which types of exercises or what type of mix of McKenzie and Williams exercises you'd be doing. But today we're going to show you some flexion Williams exercises, right? So, first one, as we said, he said, what if I just pull the knees into the chest? And that can help to gap the space in my spine between the bones. And so that's just what he did. Now, you can pull both knees in the chest. This is one, pulling both in. And what I'm doing when I'm pulling the knees in is I'm curling my head up like this. So why am I doing that? It's further tractioning the spine, okay? And so opening that space even more so. Now, another thing we're going to do is we're going to pull one leg in and then back. Pull the other leg, hold. Now you can hold it for about 15 seconds each time. And this is the same exercise as the two knees, obviously just with one, right? So those are both great. And when you're holding the two knees, figure you can hold that for about 15 to 30 seconds and then do, say, 10 reps, okay? And 10 reps on each of these legs, holding it for 15 seconds a pop. Next, you're going to bend your knees. You're going to put your hands out to the sides, which I'll hit the window here, but I want to show you this angle. And you let the legs fall to the side. Let them fall to the side. You can relax your head for this one. Let them fall. You should feel a nice little stretch in the low back there. Come up slow. When you get to the bottom, you can hold it there for a few seconds and then come back up with the legs. And then when you go to the other side, same thing. I'm demonstrating low back exercises.
I do it every day.
That's fantastic. And then come back up to center. The next one is a pelvic tilt. So you'll press your low back into the ground. Now you can relax the neck for this. Press the low back into the ground. And what you'll feel is your core activating here. And that's another principle that Williams agreed with, was if we can strengthen the core, it will help to take stress off the low back. It isn't just about opening the space between the vertebra to relieve pressure on the discs and nerves. We need a strong core, right? And so that leads us to the next exercise, which is a simple crunch, okay? In this crunch, your shoulders just come off the ground like so, and down. Off the ground like so, and down. See if you can do, say, 15 reps 2 times a day. Next one, you can do the same thing. You're going to reach this arm up to the opposite knee. And so you're going to lift just one shoulder off the ground. More of an oblique focused crunch. Same thing to the other side. And the last one we're going to show you is, I'm literally 30 seconds left, is you're going to get a chair. You can do it standing up too. Hopefully it's not on an uneven surface with my partially done floor. And you're going to come forward like this, and you can walk your hands back, gaining slightly more of a stretch in that low back. And those are some Williams exercises. They can help to take pressure off of your spine, and they can help you to heal in the early stages of spinal injury, help to prevent degenerative disc disease down the road, getting more blood oxygen and nutrients to your intervertebral discs to keep them nice and thick and healthy. This would not go, however, somebody that had an acute herniated disc. If you have an acute herniated disc and you do flexion, that's putting more stress on the nerves, right? So that's a big no-no we don't like to do. And so we would start with basic extension movements, but pretty much for everyone else. So that's what we got for you guys. I hope you had a fantastic day. And happy birthday, Uncle Brian. This one was absolutely for you. Your day in the book of Wen Wellness. Let's say hi to you guys, and we're going to get out of here. Brandon Malone, thanks for coming on, my friend. Waxon, how you doing? The Costa Store. Capri. Benny Boo. Do a video online every day. That's wellness videos. Garcia, J. Pitt. And Malcolm. You guys have a fantastic rest of your day. It's all we got for you, folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great one. Thanks a lot, and happy Wen Wellness.